Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time.
Hello, and welcome to the Functional Nurse Podcast. My name is Samantha Hamilton, and I am our Director of Growth and Partnerships over here at the Institute for Functional Nursing. And I am doing some of our podcast recordings with some of our students who are in the program, just so you can get a taste of what it's like to be a student in our program. And I have here today Autumn. Autumn Wake is a registered nurse, a lactation consultant, and she works in the Las Vegas area. She specializes in supporting families who are achieving their feeding goals, and when difficult situations arise, she helps to support the babies from birth to weaning and everything in between. She educates families on gut health, structural issues, low milk supply, and everything else you can think of regarding lactation and the postpartum period. Autumn, we're so happy to have you here today. I think we have a lot of nurses who can learn from your experience in the lactation world and how you're integrating functional nursing into your practice. So can you just tell me, how did you find functional medicine, functional nursing?
Well, I found functional medicine about probably like 8 years ago. I had some issues with my son. He was losing weight and he had some tummy issues, and I didn't feel like I was getting the right answers from our pediatrician because I was obsessed with his poops and it was not normal. And they were like, "Oh, it's fine." And I'm like, "No, I know it's not fine." So I started on the journey just trying to find some more natural providers because I have always like kind of went with what's more natural versus like the typical medical model of care. So he was the one that started my journey. I think I started with him first, and then I started seeing the same functional provider. And, I just have been on a journey for my own health. And I selfishly actually enrolled in this program so I could learn more about how to help myself and my family, but also my clients, because I have been a lactation consultant for the same amount of time. And I see these really tricky situations, and I don't really feel like I have the best support to give the mom and babies. Like, I know what I've learned from my medical situation, but I want to have a more encompassed role in helping them grow to be the healthiest families that they can be.
Right. I know personally, I had my own experience. So I have 2 children, and with my daughter, I actually had to eliminate gluten, dairy, and eggs just because she was having such strange poops. If you're here listening to a functional nurse podcast, you can expect that we're going to talk about poop at least once, right? Because we're nurses. But I think too, sometimes as parents, we have that intuition to know when something is not right, and when you need to ask someone else, and then when that person is kind of like dismissing what you're concerned about, it makes you search elsewhere for answers. And I feel like that's how a lot of nurses find functional medicine, because we either feel misaligned in our current role or we feel let down, like we're looking for something else that we're not being given in that Western model of care. So you started your own lactation business. Was that after you experienced all this stuff with your son?
Yeah, actually, he was an easy baby to breastfeed. My daughter was what led me into starting my own business. I was a hospice nurse for 10 years. And after I had her, I always tell people that breastfeeding was the hardest thing I ever did. We ended up in the NICU. There was one thing after another. She had a tongue tie. I had a breast abscess. I had to see a wound care doctor for 2 months as that healed, because a lactating wound is hard to heal because it's always moist. After that journey, I just didn't have the same connection to my hospice role, which, I mean, as you can imagine, you have to be in it for the people. So I ended up, the cards aligned, and I told my husband one day that I wanted to be a lactation consultant, and he's like, "Yeah." And it just so happened that I was able to get in the program and all the things started to move. I became the president of our breastfeeding coalition. And from there, after I got my IBCLC, which is usually quite a lengthy process, but it only took me like a year and a half. And then from having the community support from my coalition days, I just kind of fell into a busy business. That was about almost 10 years ago.
Wow, that's awesome. And at that time, did you know about functional medicine, or how did you find functional
Yeah,
medicine
I mean, it was all kind
yourself?
of happening like intertwined. There was me seeking out my IBCLC credentials, and during that time, my son was also having
Okay, that's
these
when your son
new
was having the
medical
tummy
issues.
issues.
Yeah, yeah,
Okay, and you were kinda looking elsewhere for help with him, right? And
right,
so, like,
yeah.
how did you like, the weirdest thing for me, I remember I found a book that was by this woman who's a nurse practitioner talking about how intermittent fasting can benefit women with menopause, and I was so fascinated. I was so hungry to learn more about it. I'm, like, reading her book and, like, taking notes and highlighting, and then I found functional medicine, and my mind was blown when I found out that nurses could learn functional medicine and what it was. I just thought it was the coolest thing ever. So what was kind of your like path to figuring it out or finding it?
I think it was literally last year. Well, I mean, finding it, I found it through like my own medical choices,
Right.
but how I got to seeking out integrating it into my practice, I was just looking online for CEUs and I'm like, oh, there's got to be some functional nursing somewhere. And I actually found this program because I was inquiring about another program that Bridget was on. And the nurse that met with me, she was like, well, it's like the cutoff. And so you're going to either have to wait till they revamp this program or she's going to be starting a new program. And I was like, well, you just said how amazing she is. So I want to go to her program. And after that, I looked at all the different routes that I could take as a nurse, and none of it aligned with what I like truly is my core, which is the RN. A lot of times when you're looking at those functional programs, they could be for different healthcare providers, even people without any kind of licensure. So that's what really drew me to like the Functional Nursing Institute, which
Yeah.
I am really happy with everything that I've been learning so far. But it was just kind of like me Google searching one day because I have seen multiple functional medicine practitioners. I'm like, how can I make this into lactation too?
Right. And I think that it's so cool that you're wanting to work with the person as a whole. And with breastfeeding and babies, a lot of times, kind of how I mentioned that, like the mom has to be the one to kind of make changes in their diet before because it affects the baby then. And even sometimes having those conversations too about how, like, I didn't even realize that the mode of delivery makes an impact on the microbiome of the baby. And that's even something that we ask when we're doing the IFM timeline and matrix, because we want to look at those antecedents and like what really happened from the time of birth to that could be potentially impacting how the person is feeling now. And I feel like, especially in babies, when you're working with the babies and the moms and they're having gut issues, being able to get it back to the source of the root cause, which is often, and correct me if I'm wrong, oftentimes the mom and what the mom is eating might be impacting the baby.
Yeah, absolutely. I love to work in this role because I'm one of the only providers besides a midwife that has two patients, sometimes more if there's twins or whatnot.
Yeah.
So, some of the more holistic trainings that I have taken as a lactation consultant, one of my favorite trainers, she always says, heal the mom, heal the baby. And that really connected to me because sometimes like families come in and the mom is concerned about XYZ and the baby, and she doesn't even look at herself and like what
Hmm.
is going on in her role. They're usually not eating, not sleeping, the highest stress they've ever had in their lives. And, this is what you get as a result is this fussy baby with all these rashes and weird poops and spit up and just fussiness. And we have to kind of center it back to like, where is it coming from?
So do you feel like root cause wise in terms of all these things that can happen with the babies, but then also the moms too, does like birth trauma have anything to do with it, or even like mom's anxiety anxiety levels? Like if anxiety is through the roof for mom, how does that impact baby?
Yeah, I think for sure. One of the main things that can happen, I mean, do we call it birth trauma always? But we're not like moving, we're not like sitting like we should be. And I think that puts a lot of strain on the baby's musculoskeletal system. So like a lot of babies that I see have structural issues, and it's not just about tongue ties. That's like a big hot topic in especially the lactation world. And there's so much more to it than tongue ties. And I think just the sedentary lifestyles that we live, and the more I learn in this functional program, I see how it connects back through the birth and all these interventions. You know, I see so many clients, and like most of them have every intervention known to man. Nobody goes into labor independently, and nobody's moving during labor. They always blame something on the mom when it's like, oh, you just heavily medicated the whole natural system and
Right.
this is the outcome, and we just put it back to the mom, you know? So there is a lot of that I see, and I feel like that's a source of stuff that we don't even know what it's causing. You know, never in the history of man have we had to have so many medicalized births. And everybody just keeps getting more and more comorbidities. Are we looking at, you know, how we're intervening on these births?
Right. And, I think it's important too to just touch on like how even before you found functional nursing, you were looking at the root cause of what was happening with these babies, right? Like maybe it is more of a structural issue versus a tongue tie versus positioning on the mom. And so you've already had this kind of like root cause perspective, but like how would you say that learning functional nursing is helping you incorporate that root cause thinking on another level?
I think that like the organization of it, the timeline and the matrix and how they categorize all the different aspects, it's kind of like that. I was already thinking in that role because I got to look at like what's going on with the GI stuff. How's mom's positioning? What's going on with babies like structural stuff? Do they have torticollis? Do they have a tongue tie? Like sometimes they have all these things. I really love how we have to look at what's the loudest. I think that's how I've been able to utilize all the stuff that I'm learning in this program the most is by not overwhelming people. I love how Bridget always says that, like repeatedly. I'm like, I need that. I need that. It's okay to just tell them a couple things because I shouldn't say never, but rarely do I see somebody one time. I give them the heads up when they call me, you know, when they book, that this is not something that we usually fix just overnight. I'm here little or as much as you need me, and trying not to overwhelm them because that's what I did when I was learning. I was like, oh, I just learned all this new stuff. Here's everything. And then I don't know. Mom still came to see me, but I was like, I just stressed so many people out unintentionally with information overload. And so as I have grown as a practitioner and like taking this course, I just love the reinforcement of like, we need to start with the basics and what is the loudest. And then we need to work through all the other things because maternal stress is like probably, I feel like it's higher than it was when I first started because of social media, maybe. But the moms just seem so stressed.
What do you do from a root cause or like a functional nursing perspective to try and help those moms reduce some of the stress that they might be experiencing if you know that that can, be impacting the care that they're giving their baby, how their baby's feeling, their own gut issues. What
Yeah.
are just some interventions that you usually work with your clients on?
One of the main things is I encourage people to turn off their social media. Most people won't do it, but a lot of times when families are coming in, and you can remember this when you were a new parent, everybody's telling them something different. If I'm just going to do the same thing, then how are they going to know to really validate and trust what I'm saying? So some of the things that I just try to make it simple, like what is the mom's goal? I always ask what the mom's goal is for why they're here. Why are you coming to see me? Let's make sure that I readdress that throughout the visit. Like, this is what we're talking about in your goals, but some of the interventions that like I just try to simplify their lives. They're thinking that they need to buy all these things, these pillows, these contraptions. Do I need a nipple shield? Do I need XYZ pump? Like they're coming in with like 10 pumps and spending
Yeah.
thousands of dollars. And I'm like,
Right.
you only need one pump, and let's try to work on the baby being the pump more. And my most favorite intervention to kind of simplify things, and I feel like this is the most feedback that I get from my clients, is the latching and positioning.
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
There's a really awesome course for feeding professionals, and she talks about how we're the only mammals on the planet that can't feed their babies. And when
Wow.
I think about that, every time I say that, it gives me goosebumps. Why do we have such a hard time? And as a
Right.
nurse, you remember in nursing school the primitive reflexes, the neonatal reflexes that we had to learn. Nobody ever said what they were for. Nobody ever said, what do we do with them if they're not like working the way they're supposed to, what we're assessing. And that is really like most of them are feeding reflexes. When we are teaching people in a prenatal class, we'll like touch on the breast crawl. And the breast crawl is really great, but why would we only do it one time and then we sit up and we're like shoving a boob in a baby's mouth like every single time? It drives me nuts. Every time I get a client, they are putting the baby so they're activating their startle reflex. That baby's in a stressed mode. They're just shoving a boob in the baby's mouth when the baby opens up, and it's stressful for both of them. The easiest intervention that we do is just lay back and actually let your baby participate in the feeding.
Right.
They never let the baby even participate in opening their mouth. They're like, the baby didn't get a deep latch. Well, if you line them up correctly and just let them go to town, then they usually get a better latch than anybody, because we can do it just like any other mammal on the planet.
Right.
Little baby kitty cats. They're born with their eyes closed. Why can't a human do it? So that's my favorite start to most simplify the stressful reason that they're coming. Most people are coming for that.
Right. And it sounds like you're educating them about like, let's get back to the basics. Let's get back to the foundation. Let's stop complicating things and let's just do what our bodies were designed to do. And a lot of times it's our bodies they're made to heal, right? So like for example, like with a baby who say might be experiencing like they can't have dairy, mom needs to eliminate dairy, for example, and then letting the baby's body heal, let the inflammation in the gut go down after mom is eliminating dairy, for example. And how do you help walk moms through something like that where you're like, this might be an option for us? How do you walk moms through something? They're already stressed and now you're like, okay, we're going to change something and this might help. How does that work for you?
Well, I preface it by saying that dairy is the number one allergen in humans. And I don't know why we give it to babies straight dairy cow milk formula. The Academy of Breastfeeding Medicine, I haven't read their protocols recently, but when I was learning, they said that we shouldn't be starting babies with, if it's not like mother's milk, express milk, donor milk, then it should be a hypoallergenic formula, because there's research that says that even small amounts of early introduction of these formulas can increase their allergies by like 10 times or something. Don't quote me on that. It's a known thing to cause problems with people. And a lot of times the moms are like, oh, but I'm fine with it. And I had this experience. That was one of the things on my resume with my daughter being the hardest thing I ever had to do was breastfeed her. After I got through my abscess, and actually that's a lie. The dairy came before the abscess. But I ate so bad with her. I ate dairy like it was going out of style. And when she was like 5 weeks old, we went to the pediatrician, and the pediatrician was like, oh, yeah, that's a dairy. You need to cut that out. We need to give her, we had to supplement her with formula at this time. And I had to give her a special formula. So I got to learn about it from the school of hard knocks. I was eating macaroni and cheese, gallons of cow milk, and I cut out everything because I didn't care what happened to me. I was going to breastfeed this girl. If it killed me, which it almost did. So I share my experience because I really thought dairy was like something I'd never have a problem with, but I cut it out of my, my diet completely. My daughter got better.
Yeah.
And then I tried to eat it after that. And ever since I cut it out for like several months, I've never been the same with dairy. So I just like give them education and information, and I let them do whatever they want to do. And I tell them from the second that they come in, I'm not making these choices. I'm here to give you advice and information and resources relating to what I see from this very in-depth assessment that I am doing of you guys. I state like the symptoms that they're having, and I explain to them the process of having to eliminate it. And I also tell them that it's not a forever thing. You can do anything for, 3 or 4 weeks and see how you feel. And then maybe we start to like try a little bit, because you don't want to eliminate it altogether, because that can sometimes cause more issues with baby and their sensitivities later on in life. I'm not one that like beats around the bush. I just give it to them. Then if we follow up, I just ask if they have questions. Is this something that you're implementing? Are you seeing improvements? And a lot of the times people will be like, I cut back. And I'm like, well, that's why your baby's still having problems. So maybe we can, since we already cut back, maybe we can just cut it out for a week or two. You should start to see improvements at that point, and then we can go from there. If we don't see improvements, then maybe we need to see if it's something else. I try to help them understand the process, and it's not something that's like you just cut it out for one day and it's good.
And I feel like too, even with my clients that I have that aren't necessarily doing it for breastfeeding needs, but they're doing it because it's such a high allergen and inflammatory food. A lot of times you have to like introduce the idea, and I feel like food is so centered around like community, or our community is centered around food, that like to say like, okay, we're gonna, how do you feel about eliminating dairy? And a lot of times you have to say it a few times before they're like open to the idea. And then once we do finally do it, you're looking at all of the hidden sources of dairy. And I remember when I eliminated dairy, I was really good about not having it, but then I made a slow cooker meal that had cream of chicken soup in it. And then my daughter started having like those runny like poops again, and I was like, "What is it?" And then it like hit me. I was like, "Oh, the cream of chicken soup. It had milk in it." And I feel like it's so challenging when we're trying to find all of these sources, and then we get some kind of a feedback, whether it's our own body or our child's body, then when we're nursing, that we're like, what did I find it in? What was it in that I didn't realize? And so I think that there's such a big area for us to help coach our clients through their needs with eliminating food too.
This wasn't a one-time thing for the dairy. I didn't quite learn my lesson, and I did start to introduce it back once I got pregnant with my second child, and he came out green poops, rash, just right out of the gate. And so I cut it all out, but then it still kept happening with the green slimy poops. And I'm like, oh my gosh, what is it? And it was in my multivitamin. And once I cut it out of my multivitamin, then he was fine. But I tell everybody from my experience with that, like, you need to look at every single thing you put in your mouth, any kind of supplements you take, anything you're drinking. And I just educate them on what are the main culprits.
So, okay, I have a question for you, and for any lactation consultants who are listening to this podcast, I just want to know more of the ins and outs, kind of like businessy side of how are you incorporating functional medicine, functional nursing into your practice? Are you using any of the tools? Are you providing education on your discharge summaries for your clients? How is this being applied other than like the knowledge that you're giving your client? Are you doing anything from the business perspective as a lactation consultant?
I am still in the I'm editing my website right now, and we're not halfway through it yet. So I haven't
Right.
completed the whole course. I am trying not to overwhelm myself and changing everything while I'm trying to do this course. So there are things that I have planned to set up, but as far as what I'm implementing, I haven't really changed my practice because I have it all set. All the things are already set up in my automations and things like that. So I have to revamp everything, my resources and things like that. But I have started utilizing the food planning stuff. I give that to my clients. How to build a better smoothie is my favorite resource to share with people. And just in general, any kind of resources I've added to my care plans that I send for everybody.
Mhm.
And I found that has been helpful in my start when we were just opening up the learning books, and I got really excited. And I think I was overdoing it with especially like the glucose and, just everything. And I remember Bridget also saying, like, not everybody wants to hear about
Right.
everything you're learning. So I had to ask for permission from my
Yeah.
clients
Right.
moving forward because they're not coming to see me for functional medicine.
Right.
They're coming to
Right.
see me because they're desperate to get their baby fed. So the extra stuff is just a bonus. But after I realized, man, I just word vomited a lot of the stuff I learned the first few weeks. I was like, okay, I'm just going to ask them permission now. Do you guys want me to like help you with this? Because I have extra knowledge looking at labs, like some of my more complicated patients with different comorbidities. They'll send me their labs and I'll look as far as resources go for them. And so that has been how I have implemented the most. But I hope to be able to do more of that when I have finished the program and have kind of like more in-depth knowledge of those things.
No, yeah, and I think it's so easy to like get excited when you're learning this stuff because you're starting to uncover all this stuff that it's almost like you're like, I knew there was a better way to do this. I knew there was more I could do. And then it's so great that you're like, I just want to share it with everybody. And then kind of like Bridget's like, you got to reel it back a little bit. Like,
Yes.
not everybody shares the same enthusiasm. They're not all going through the program right now. And so it's totally true. It's so hard to like gain that sense of like, okay, not everybody wants to hear everything that I'm saying right now. So, just a question for you. What has been your favorite part of the program in the functional nurse program?
I think all the nutrition stuff, because I've already been a geek about that. I'm learning a lot about like just how to incorporate that in my own life. And I am looking forward to learning that more. But definitely like nutrition is the one like favorite that I would have to pick.
Yeah, I think it's so interesting that like we have to learn nutrition, right? Because and I think a lot of times people frame it as diet, whereas I prefer the term nutrition because we're trying to provide our body with nutrients, right? The things that we need to keep our body running well. And so something that our students get when they're enrolled in our program is a 1 year membership with the Institute for Functional Medicine, where our students get to use all of the toolkit items, which you were talking about, like building a better smoothly. That's
Mhm.
one of the toolkit items that our students have access to, in addition to several others where we're helping our clients through the elimination diet. We're educating them about polyphenols and macronutrients, micronutrients. So that's one of the benefits of our program is that all of our students get that 1 year membership with access to all of the toolkit items, which I think is so helpful. It's just having that giant resource, like the toolbox of things that you can use. So another question for you would just be, do you have any advice for lactation consultants who are out there who are maybe listening to our podcast or are considering our program? Do you have anything that you would kind of tell them?
I mean, I would say that for me, it has been really easy to incorporate into my lifestyle. I'm not on social media or anything, but you could cut off an hour of your social media time and do the coursework. The books have been really good, and they're not like you don't have to go buy a bunch of textbooks, which I really liked that. There's tons of
Yeah.
resources embedded in each module, which are really cool. Lots of research to back up what you're learning too. So for the people who might be a little bit skeptical, that's something you don't have to do the legwork for. I think it's just really well rounded, and I feel like the teachers that are educating on the topics are really interesting, and you can see their passion, and I really love that. I feel like I know them, even though
Right.
you haven't got to meet them yet. I also love that there are a lot of resources as far as like the meetups and things like that, because that's something that you're never going to know everything, especially when you're just learning. When I was just starting as a lactation consultant, I learned all this stuff. I passed all the tests. I, took all these extra CEUs, but having to like incorporate it into practice, getting patients to, kind of buy into what you're saying is a challenge. And so the fact that you get these people that have already done that, and you can ask them questions, you can post on the member boards, I really like that.
So for anyone who doesn't know, within our program, you get access to our functional nursing membership, which I like to call our community, because it's kind of like being in the room with a bunch of other nurses who are also doing functional medicine. And we have 4 time per month live calls with our faculty members. And the way that I like to kind of relate that to is almost when you were like in nursing school and you'd go to class and you'd have your faculty member there, you'd kind of chit chat with your peers a little bit, and then you'd go home, do your learning, come back the next week, your faculty member was there, you could ask questions, chat with your peers. So it's just a really good opportunity to get to know the people who are in your cohort, to get to know kind of the personalities of your faculty members. And like Autumn, what you were just saying, that like it seems like everybody's really like enthusiastic, they love what they do. We have 9 faculty members who are all IFM certified through the Institute for Functional Medicine, and all of our nurse practitioners, they work in a clinic where they're doing their specialty, and then they come in our program and they teach their specialty. So they're really well versed on what they're talking about. And that's one of my favorite parts too, is just our community and getting to know more people who are like-minded and who are interested in learning functional medicine. So do you have any final words or final thoughts, Autumn, for anyone who might be listening that's interested in lactation, also interested in our functional nurse program?
I think it's something that is worth the investment, and this is where medicine is going. We can't stay where we are. And I think that it is good to get ahead of the curve. Well, that's where I have found the most use out of a lot of the resources and things that I've learned.
Right. I do. I think that this is kind of the direction that healthcare is going in, and people want to move more towards that wellness continuum, right? Where we're trying to fight the dis-ease that we're experiencing. And so I'm so happy that I got to spend the time with you today, Autumn. I think it's just so great that you're able to help these moms who are in that postpartum period and help their babes, because those moms, those clients are so motivated because they want to just do whatever they can to help their baby, their child, feel better, stop the crying, have better poops. So I'm so glad that you were able to come and talk with us here on the Functional Nurse Podcast. And thank you all. Have a good day.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.